Let me ask you something. When was the last time you thought about your gums? Not your heart, not your blood pressure. Your gums. Probably not recently. And that is exactly the problem. What most people don't realize, and what most doctors don't tell you, is that your gums are one of the earliest warning systems your body has for heart disease. Not a warning sign you'll feel in your chest. Not one that shows up on a blood pressure monitor. A warning that shows up in your mouth. Years, sometimes a decade, before your heart gives you any signal at all.
Here is what the research actually says. People with gum disease, technically called periodontitis, are between 2 and 3 times more likely to have a heart attack, stroke, or serious cardiovascular event than people without it. 2 to 3 times more likely from your gums. Now, for a long time, doctors assumed this was just a coincidence. People who don't brush also don't exercise. People who smoke get gum disease and heart disease. But after decades of research, the science is now very clear. This is not a coincidence. This is a direct biological connection. And here is the part that shocks most people. The damage to your arteries from gum disease can begin years, sometimes 10 years, before your heart shows any symptoms whatsoever. Your cardiologist checks your cholesterol, your doctor checks your blood pressure, but almost nobody is looking in your mouth. And that gap in your care could be costing you years of your life.
So how does this actually happen? Let me explain the mechanism, because once you understand it, you will never look at bleeding gums the same way again. Your gum line is where your teeth meet soft tissue, and that tissue, when healthy, forms a tight seal around each tooth. Think of it like a gasket. When that seal is intact, bacteria stay in your mouth where your saliva can manage them. But when gum disease sets in, that seal breaks down. Small pockets form between your teeth and gums, and in those pockets, bacteria multiply rapidly in an environment with very little oxygen, exactly the kind of bacteria that your immune system treats as a serious threat. Viewers need to visualize the pathway. Now, here's where it gets dangerous. Every single time you chew, brush, or even swallow, those bacteria enter your bloodstream through the inflamed gum tissue. This is called bacteremia. Your immune system responds immediately. It floods your bloodstream with inflammatory molecules called cytokines, and those cytokines travel straight to your arteries. Inside your arteries, this chronic low-grade inflammation causes the arterial walls to thicken and harden. Plaque builds up faster, blood clots are more likely to form, and over years, slowly, silently, your risk of heart attack and stroke climbs. A landmark study published in the Journal of the American Heart Association found that treating gum disease actually improved the flexibility of blood vessels, meaning healthier gums literally translated into healthier arteries. The connection goes both ways.
So what should you actually look for? Let me give you the 5 warning signs that your gums may already be in trouble and that your heart may be paying the price. Warning sign 1, bleeding when you brush or floss. Most people think this is normal. It is not normal. Healthy gums do not bleed. If yours bleed regularly, that is active inflammation. And active inflammation means bacteria are already breaching that barrier into your bloodstream. Warning sign 2, puffy, red, or swollen gums. Gums should be firm and pale pink. If yours look red, swollen, or feel tender to the touch, that is your immune system actively fighting infection in your mouth right now. Warning sign 3, persistent bad breath. Not morning breath. Persistent bad breath that doesn't resolve with brushing. This is the smell of bacterial colonies living in the pockets of your gums. If mouthwash and brushing don't fix it, the problem is deeper than the surface. Warning sign 4, gums pulling away from your teeth. If your teeth look longer than they used to, or if you can see the root of any tooth, your gums are receding. This is advanced gum disease and needs immediate attention. Warning sign 5, loose teeth in adulthood. Adult teeth should not move. If any of your teeth feel loose, the bone supporting them is already being destroyed by bacterial infection. This is a medical emergency.
Now, here is the genuinely good news. Unlike most heart risk factors, this one is highly reversible, especially if you catch it early. Let me give you 4 things you can do starting this week. Step 1, see a periodontist, not just a dentist. A regular dental cleaning removes surface tartar, but if you have active gum disease, you need a procedure called scaling and root planing, a deep clean below the gum line that removes the bacterial colonies. Studies show this procedure alone can reduce systemic inflammation markers within weeks. Step 2. Switch to an electric toothbrush. Research consistently shows electric toothbrushes reduce gum inflammation significantly more than manual brushing in people over 60. The oscillating head cleans the gum line in a way that most people simply cannot replicate by hand. Step 3. Floss differently. Most people floss wrong. They snap the floss between teeth and stop. The correct technique is to curve the floss into a C shape around each tooth and slide it gently below the gum line. If you find flossing difficult, a water flosser is an excellent alternative and highly effective for seniors. Step 4. Tell your cardiologist about your gums. This is the step most people skip entirely. If you have any history of gum disease, your cardiologist needs to know. It changes how aggressively they monitor your cardiovascular risk. You have the right to ask for a high-sensitivity CRP test. That measures systemic inflammation in your blood, and many doctors will now order it if you mention a history of periodontal disease.
I want you to do one thing after watching this video. Just one. Go to a mirror, lift your lip, and look at your gums. Are they pink and firm, or are they red, puffy, or pulling back? That 10-second check could be the most important health check you do all month. And if anything looks off, please do not wait for your next routine dental appointment. Call your dentist this week and mention gum disease specifically. Say the word periodontitis. That gets you the right level of care. If this video helped you, share it with someone you love who is over 60. Heart disease is still the #1 killer of seniors, and most people have no idea their mouth is part of the picture.